Hello friends, today we will discuss about femur. Femur is the longest and the strongest bone of the body. It is present in the thigh and it is about 18 inches and it is about 1/4 of the height of an individual. So, its upper end it will articulate with the hip bone to form the hip joint, whereas the lower end it articulates with the patella and the tibia to form the knee joint. Okay. Now, let us see the parts of the femur in detail. Okay. So, in this video let me clear you, we will just discuss the various parts of the femur. In the next video we will discuss about the various attachments. Okay. So, parts of the femur. So, basically it is divided into upper end, then shaft, this is the shaft and this is the lower end. Okay. We will discuss the parts in the upper end, lower end and the shaft and some important landmarks. So, in the upper end it consists of the head. What I am holding, this is the head, and this part it is called as neck of the femur. Okay. This part it is called as neck and this it is known as greater trochanter. This part which I am holding it is known as greater trochanter, and on the posterior side, that is on the back side, it is known as lesser trochanter, this part. Okay. This is known as lesser trochanter. This is greater trochanter, this is lesser trochanter. So, how many parts are there in the upper end? Head, neck, greater trochanter and lesser trochanter. Okay. Now, this is the shaft. Then at the lower end there is medial condyle, lateral condyle, and the space between this it is known as intercondylar fossa. Okay. Now, let us discuss the anatomical position and the side determination. So, for this is the right sided femur. Okay. This is the right sided femur. So, it head faces upwards, medially and slightly forwards. Okay. So, this head will faces upwards, medially and slightly forward. Okay. It is like this, and the long axis of the shaft is directed downwards and medially, like this, downwards and bit medially. So, the long axis of the shaft is directed downwards and medially. So, the lower surface of both the condyles are in the same horizontal plane. So, the lower surface of both the condyles are in the same horizontal plane. So, there is a trick here. The anatomical position can be achieved by balancing the neck of the femur on your index finger, like this. If you just hold it on your index finger, now this is the anatomical position. Okay. Anyway, now here we will discuss about the very important angle, that is known as angle of inclination of the femur or the neck shaft angle. Okay. So, it is the angle between the long axis of the neck and the shaft of the femur. Hence, it is also called as neck shaft angle. So, the normal neck shaft angle is 125 degree. Let me show you. So, see, this is the long axis of the neck with the help of a scale, and this is the shaft. So, long axis of the neck and the long axis of the shaft, they form an angle. This is around 125 degrees. Okay. It will be more like 160 degree in the children, it is less in the females. Okay. So, this is normal neck shaft angle 125 degree, long axis of the neck and long axis of the shaft. Okay. Now, let us see some important landmarks in the various parts of the femur. So, first come to the upper end. So, upper end, this is the head which forms about 2/3 of a sphere and it will articulate with the acetabulum of the hip bone. Now, it presents with a small pit, it is called as fovea. Okay. Just below and behind the center, this pit it is called as fovea. Now, the neck it is 5 centimeter long. Okay. So, 5 centimeter long, it has upper border, lower border and anterior surface and posterior surface. So, neck has 5 centimeter long and it has upper border, lower border, anterior surface and posterior surface. Its anterior surface, there is one line that will meet the shaft, it is known as intertrochanteric line. So, with the help of this blue chalk piece, what I am marking now, this is intertrochanteric line. So, this intertrochanteric line which is present on the anterior surface of the neck of the femur, so it will continue downwards and medially below the lesser trochanter here, like this. This is the lesser trochanter. Okay. Lesser trochanter on the posterior aspect of the femur as spiral line. Now, this will continuous as spiral line. This line what I am marking it, this is continuous as spiral line. on the posterior aspect, that is on the back side. This is intertrochanteric line on the anterior surface of the neck of the femur. Now, on the posterior surface, that is on the back side of the neck, we are discussing only about the neck right now. It has upper border, lower border, anterior surface and posterior surface. Anterior surface, important landmark, intertrochanteric line, which will continue posteriorly as spiral line. Okay. Now, the posterior aspect, the neck, okay, it will present, it meets the shaft at the intertrochanteric crest. Now, this thing on the posterior aspect of the neck, what you are seeing, this is the intertrochanteric crest, this blue color line which I am putting with the, okay, this is with the blue chalk piece, it is intertrochanteric crest. Okay. Now, this intertrochanteric crest extends from the posterior superior angle of the greater trochanter. This is the greater trochanter which we are going to discuss now. So, posterior superior, it is on the back side, posterior superior angle of the greater trochanter to the tip of the lesser trochanter. This is the lesser trochanter. So, this line it is known as intertrochanteric crest. Okay. Now, it presents a rounded tubercle near the middle chord as quadrate tubercle. So, now with the help of this another color chalk piece, that is around brown chalk piece, I am highlighting it. This is the quadrate tubercle. So, it presents a rounded tubercle near the middle called as quadrate tubercle. So, we have discussed about the head, neck. Okay. Now, coming to the greater trochanter. So, it is a quadrilateral elevation projecting upward from the lateral aspect of the junction of the neck and shaft. So, again it has a upper border, then surfaces, anterior surface, medial surface and lateral surface. So, this part, that is the greater trochanter, it has upper border, anterior surface, lateral surface and medial surface. So, its medial surface actually has two depression. One depression, it is known as trochanteric fossa, a depression at its junction with the neck for insertion of obturator externus muscle. Okay. So, this depression it is known as trochanteric fossa. Okay. The important landmark in the greater trochanter on the medial surface. Okay. See, this is the medial surface. Medial surface, there is a one fossa or depression, it is known as it is known as trochanteric fossa. It is known as trochanteric fossa. Okay. Now, this is the lesser trochanter. This is the lesser trochanter. So, this is all about the upper end. So, just to summarize, upper end has head, neck, greater trochanter and lesser trochanter, intertrochanteric line you should know, then spiral line, then intertrochanteric crest, quadrate tubercle and trochanteric fossa. Now, shaft. Now, this is the shaft. So, shaft, the middle third, in the middle third of the posterior side of the shaft, okay, this posterior side middle third, posterior border is represented by a thick ridge, it is called as linea aspera. Now, I will mark it, this you can see this thick ridge on the posterior aspect, this middle third, this it is called as linea aspera. So, which acts as a buttress to resist the compressive forces and prevents the anterior bowing of the shaft. Okay. So, now this linea aspera presents inner and outer lips and an intervening intermediate area. Okay. Now, when the upper end of this linea aspera is traced upwards, you can see its inner and outer lip diverge and enclose a triangular posterior surface of the upper one third. So, you can see upper one third there is a triangular posterior surface, okay, triangular posterior surface. Now, this is the triangular posterior surface found by this linea aspera both lips, medial and lateral, upper middle third. Okay. Now, the inner lip continues with the spiral line. So, you have seen spiral line found by the intertrochanteric line, the inner lip continues with the spiral line and the outer lip becomes continuous with the gluteal tuberosity. Now, this thing it is known as gluteal tuberosity, okay, continuous with the gluteal tuberosity. Okay. Now, when lower end of the shaft, the linea aspera is traced downwards, its inner and outer lips will again it will be diverged to below to enclose a triangular space known as popliteal fossa. Now, this triangular space it is known as popliteal fossa. Okay. Popliteal fossa, that is all about the shaft. Okay. You should just remember linea aspera, popliteal fossa and the posterior surface. Now, the lower part of the femur basically made up of medial condyle, lateral condyle. Okay. medial and lateral condyle, and the most prominent points on the medial and the lateral part, it is called as medial epicondyle, most epicondyle and lateral epicondyle. Okay. Now, there is a projection on the posterior superior to the medial epicondyle which is called as adductor tubercle. Now, this is the adductor tubercle, posterior superior in the medial condyle, the projection on the posterior superior to the medial epicondyle. So, this is the medial epicondyle. So, posterior superior to the medial epicondyle, it is called as adductor tubercle. Okay. Now, lateral condyle, again the lateral surface presents a prominence called as lateral epicondyle. So, in between these two there is a notch that is known as intercondylar fossa or intercondylar notch, that is all. You should remember medial condyle, lateral condyle, medial epicondyle, lateral epicondyle, and this adductor tubercle on the medial epicondyle. Okay. So, just posterior superior to the medial epicondyle, it is the adductor tubercle. So, this is all about the parts of the femur. In the next video, we will describe with mnemonic if possible about the attachments of the femur. Thank you.